Doctors in dozens of states, including Illinois, seeing a big jump in cases of RSV in young children.
It's a respiratory infection that typically impacts babies and toddlers, and hospitals are reporting a spike in the infections earlier than normal. Dr. Nicholas Zessis is a pediatrician at Lurie Children's Hospital. He's been so kind to join us now. Welcome, doctor.
Thank you so much for having me.
Let's talk about the symptoms and how they maybe compare and contrast to some of the other respiratory stuff out there.
Yeah, it can be hard to tell the difference. You know, COVID hasn't affected kids to the same extent from a respiratory standpoint as adults, but you know, in trying to tease it between RSV and flu can be difficult. But typically what you're seeing, there's two phases that you look for. Phase one looks like the common cold. So you may or may not have fever, but definitely you're going to be having some runny nose, congestion, and cough. And the biggest thing that you want to look at there, if you're a parent of a baby, and you're considering, you know, do I talk to my pediatrician? Do I go to the hospital? With that phase is about hydration. So as you can imagine, I mean, if your nose is stuffed up and you're a baby and you're trying to feed at the same time, it can be hard to do both at once. And so feedings aren't going as well. And so one sign that it's time to see your pediatrician is, hey, wait a minute, you know, my baby is making less than 3 or 4 wet diapers a day is a good indication to see if they're hydrated or not. And that's something that sometimes can result in hospitalization if a baby is not able to stay hydrated as a result. Phase two then is the virus can get into the lungs, although that doesn't always happen. And so what you'll see is some labored breathing, maybe a little bit faster, but you're going to want to consider calling your pediatrician and going in the emergency room if you're starting to see tugging of the just below the ribs, the muscles in between the ribs are getting sucked in and out. And then some later findings would be bobbing of the head, nostril flaring, and even grunting would be a more severe finding. And so that would be a suggestion that the disease is not mild, it's more moderate severe. And most cases of RSV and influenza in babies are in the mild stage and don't require hospitalization, but some of those later findings, unfortunately, would require a trip to the ER for your neighborhood-friendly pediatrician to evaluate.
So it's two phases we should look for. What ages are we talking about that are affected? Why is it so bad this year, and is it contagious?
Yeah, so great questions. RSV typically is worse if you're less than 6 months of age, although we can see it up to age 3, 4, and 5 years old. The reason that it's so typically RSV follows influenza. January and February in Chicago are when it really rears its head. We've started seeing high numbers in Chicago even in the summer and September, and now we're seeing winter levels of RSV in the city, and we're also getting referred children from the suburbs and further away. And so it's following the national trend. And the trend was also happening in the southern hemisphere during their winter. A lot of different reasons, but the thing, you know, another COVID keeps giving us gifts, unfortunately. So during the pandemic, kids weren't going to daycare, they weren't going to school, folks were masking. And so that, you know, it was great at the time because that mitigated the normal kid virus transmission, which RSV is one. But there's no, you know, not as good community protection. And so when you get kids back in school and play dates and things like that, is where it typically spreads. And
so it's contagious, basically.
A lot faster.
So it is contagious.
It's contagious for about 10 to 11 days on average.
Just about out of time. Any over-the-counters you recommend? And I seen to my wife, would you nebulizer work with this kind of a thing? It's been so long since our kids were young. Does that track, doctor?
Yeah, so for RSV, not necessarily a nebulizer, you know, humidified air can help, but what I would suggest to parents, if you're trying to manage this at home, a bulb suction before feedings,
which they love.
Smaller quantities more frequently is going to lead to more success trying to feed a fussy baby with RSV at home.
Yeah, that never went well. Thank you, Dr. Nicholas Zessis. We appreciate your help on this.
Yeah.
Thank you so much.
Knowledge is power. Thank you.